Well, good afternoon. We're in a fight of our lives right now, in the fight against this virus. It's a test that will define our generation. It's the test that will define us as a people and as a province. And when they look back on this, when the history books are written, we'll be judged on how we looked out for each other, but even more importantly, we'll be judged on who we looked out after and who could not look after themselves. And we owe it to our most vulnerable. We owe it to their families and loved ones to fight this terrible virus until the end. We owe it to them to leave nothing on the table, and today we're throwing everything we've got at our long-term care homes. We're mobilizing every available resource. We will stop at nothing to protect those who cannot protect themselves. Today, we're launching an all-out plan to fight COVID-19 in our long-term care homes. We will fortify the iron ring of protection around our long-term care residents and those who care for them. We'll go further in our testing, screening, surveillance, targeting the homes facing outbreaks. We will ensure the staff at these homes have the tools they need. That means strengthening protocols, training, and education on infection prevention and control. And it means ensuring priority distribution of personal protective equipment. We're getting PPE to long-term care homes in need within 24 hours or less. We'll put more boots on the ground. We're putting together COVID-19 SWAT teams drawn from our hospitals, home care, and public health care units to help homes manage outbreaks. And finally, we're focusing on prevention and preparing the long-term care homes with no outbreaks with a plan on what to do in the event of an outbreak. This plan builds on the work we've done to date. Emergency funding for hiring more staff, restricting non-essential visitors, 24/7 screening of staff and residents, and stepping up cleaning measures. And last night, we passed an emergency order to ensure every employee in long-term care homes can only work in one home, which will help protect residents and reduce the risk of potential exposure to the virus. We'll continue to use every tool. We will spare no expense to protect residents and staff and keep them safe and healthy. And to every worker in every long-term care home across this province, thank you. You're the heroes in this crisis. Whether it's cleaning or cooking, performing medical exams or giving medication, holding mom's hand, or setting up dad's iPad so he can talk to the kids, you're there. To call you an essential worker is an understatement. You are the caregivers and protectors of our most vulnerable. I want you to know this government has your back. Thank you for all that you do. Finally, before I finish, I want to give a special shout out to my friend Flavio Volpe. Flavio has gotten together with the folks at Mitchell Plastics. They're manufacturing 400,000 made in Ontario face shields for hardworking frontline staff at long-term care homes. This is just another incredible example of the true Ontario spirit. Thank you so much. Flavio and everyone at Mitchell Plastics, you are absolute champions. Thank you, and God bless the people of Ontario. Now I'd like to invite Minister Fullerton.
We are in extraordinary times. COVID-19 continues to spread, the likes of which we have never seen. And my heart goes out to everyone who has been affected by this virus in our long-term care homes. And I want a special mention of our personal support workers who are dedicated and compassionate day in, day out. I cannot thank them enough. And there are really no words that I can say to provide comfort, but please accept my sincerest condolences and know my heart goes out to everyone who's been affected by this virus. Thank you to all our caregivers that are working nonstop on the front lines to provide care to our loved ones. You are true heroes. Our government is steadfast in our commitment to fight this horrible virus with everything we've got. And as the Premier said, we will spare no expense to keep our most vulnerable residents safe. We have acted swiftly and decisively. Despite our efforts, this virus continues to spread and damage the lives of so many. Our government is working around the clock to identify every tool possible that we can use to stop the spread of this virus and keep people safe, especially residents in long-term care and their caregivers. Today, we are happy to launch Ontario's COVID-19 Action Plan for Long-Term Care Homes. And over the next 48 hours, we will be launching more aggressive testing, screening, and surveillance by screening all symptomatic staff and residents, as well as asymptomatic contacts of confirmed cases. We will be enhancing testing in all homes with a targeted plan for homes in outbreak, and testing of asymptomatic residents and staff in select homes across the province to help inform understanding of spread in long-term care homes. We will be managing outbreaks and spread of the disease through a new emergency order that was issued last night, limiting work sites for all workers in long-term care. We are working with public health units to assess risk for all homes, which is already underway as we speak. And we are actioning additional supports, including infection prevention and control, coming from the health sector, and we will establish rapid deployment teams through local hospitals to long-term care homes. We will be growing our heroic long-term care workforce by deploying hospital and home care resources into homes when needed. And we are also utilizing Ontario's job matching portal, as well as the federal HR portal, to identify available resources for over 190 homes that have submitted requests for staff. Every option is on the table, and additional measures will be taken as we address this fast-changing outbreak. Our government is working collaboratively with Public Health Ontario to identify options to help older homes with better isolation measures. And this could include movement of patients to other facilities to improve isolation capacity. Again, we will continue fighting this virus with everything we've got, and we will continue fighting to keep you, your loved ones, and our healthcare heroes safe. Thank you.
We'll go to the phone line for questions. First question.
First question comes from Mike Crawley at CBC News. Please go ahead.
Premier, can you explain why the government stopped doing comprehensive inspections of long-term care homes in Ontario last year? And I'd ask you to make sure that you please talk about the comprehensive annual inspections, not inspections in response to complaints, but we've learned through CBC's investigation that all but a handful of the 600 and something long-term care homes did not receive a comprehensive annual inspection last year. What's your explanation for why this happened?
Well, it's better answered by one of my ministers here.
Thank you for the question. We moved to a risk-based inspection process, really to make sure that the homes that were at highest risk were getting the attention that they needed. We also maintained inspections on a yearly basis for all homes. So the move was to a risk-based method, which we believed would help identify and support those homes in greatest need. Thank you.
Well, if I could follow up, is there any explanation as to why only 9 homes of the 630 homes actually deserved that full inspection? You didn't think that the risks existed at the other 620 homes? And can you tell people that there is no way that reduction in inspections contributed to what we're seeing in the long-term care homes today?
Well, looking globally, the long-term care homes are on the front lines. All across the world, it is the long-term care homes that are being severely affected by this. So the approach with the risk-based approach for long-term care inspections was in addition to annual inspections that go on through all of the 626 long-term care homes. And in addition, there's an action line for anyone who's concerned about anything in the home that they find worrisome. So we act on all those, and we act swiftly. This is a global situation across the world in terms of the effect in long-term care homes.
Next question.
Next question comes from Christina Tenaglia from CP24. Please go ahead.
Hi, Premier. Hi, Doctor and Minister. Premier, the announcement today, of course, doesn't include group homes like Participation House in Markham, where as of yesterday, 37 of the 42 residents there tested positive for COVID-19. We just learned that one of those residents has died. Of course, this is a home that houses some of our community's most vulnerable adults with physical and developmental disabilities. What is the government going to do for group homes because they are excluded from this announcement today?
Yeah, it's a very, very good question. I've been on the phone constantly with Minister Smith and MPP Paul Calandra, and also I've talked to Mayor Scarpitti out in Markham. Those are one of the highest priorities. Our announcement today right now is about long-term care homes. That doesn't mean that we aren't going to put the resources into other areas and other ministries. We are. That's going to be one of the highest priorities. And over the next day or so, you'll hear the rollout from Minister Smith. But it's extremely important. My heart breaks for these people. Almost everyone in that home has contacted COVID, and it's heartbreaking. Going back to the frontline people there, I want to thank them. The people that stayed there, and there was less than a handful. And I just want to thank them for staying at their post and trying to run the whole home by themselves. We have resources in there right now.
Thank you, Premier. I know a lot of the questions today will be about long-term care homes. I've been waiting to ask about this, about small businesses here in the province. Tomorrow, landlords can start evicting and taking back commercial property from any tenant who hasn't paid April rent. I know Minister Phillips is not there today, but we continue to hear from a lot of small business owners who feel that their immediate needs aren't met by any provincial initiatives or federal initiatives, including the CERB. Can we anticipate an announcement that will directly meet their needs, especially on the rent front specifically, something the opposition has been calling for?
Well, Minister Phillips has been working on this with the federal government as well. You have to realize there's 1.2 million leases just here in Ontario, and we need the support of the federal government if we're going to look at this. I encourage the landlords and the tenants when it comes to commercial leases, try to sit down, work it out. I know there's a small business loan, I believe it's $40,000 from the federal government that they can utilize as well to pay rent over the next couple months until we get back on track here. But there's a little bit of money there from the federal government. But again, I know Minister Phillips, that's top of mind for him, and he's going to be working with the federal government to see how we can support the small businesses.
Next question.
Next question comes from Alison Jones at the Canadian Press. Please go ahead.
Hi, Premier. On your emergency order limiting staff to working at just one long-term care home, is that going to be just for the duration of the pandemic, or is this going to be a permanent thing?
Well, I'll pass this over to the Minister of Long-Term Care.
Thank you. So that emergency order is for 14 days. We have been very cognizant and aware of the staffing shortages and the critical staffing issues in long-term care homes. And so weeks ago, the Chief Medical Officer of Health strongly recommended that all homes consider how they could potentially reduce the number of work sites that their employees are at. So this started weeks ago. This emergency order now is to really define this and make it definitive that it's only one long-term care home for employees. If they work at additional homes, they will be allowed to take a leave of absence. So this is a temporary measure.
Are you giving any consideration to making it permanent? This is obviously something that has been an issue for a long time, predating this pandemic.
Yes, and that's a really important point. When we became a dedicated ministry for long-term care, we knew that the shortages of personal support workers in our long-term care home was an issue, and we had begun to look into that and create measures that would address that. Unfortunately, the pandemic has arrived before that work was completed, but that will be ongoing. Thank you.
Next question.
Next question comes from Laura Stone from the Globe and Mail. Please go ahead.
Hi, Minister. Just to follow up on Allison's question regarding part-time workers, can you explain the scope of this? How many people working in long-term care during this crisis were actually working in multiple homes, and how will their wages and benefits be topped up by the provincial government if they are having to choose now just one part-time job?
Mm-hmm. So they will be able to, if they work at more than one home, they will be able to take a leave of absence from the other locations of work until this is sorted out in 14 days. So this is a temporary measure to allow for a reduction of the spread of COVID-19, and which is becoming increasingly apparent that it is asymptomatic. So we'll be working with the federal government through the efforts that are already underway to address the wage situation and the compensation.
And Mr. Premier, you talk about this action plan as being a preventative measure. You talk about moving swiftly. I think there are a lot of people in this province who have family members in long-term care who begged homes to do more and have watched people die because additional measures have not been taken. So why has Ontario taken so long to implement an action plan 2 weeks after the Bob Cajun incident? And what do you tell those families who are looking now and thinking that their loved ones could have been saved earlier?
Well, first of all, my heart breaks for these families. I'm facing it in my own family, and there's endless amount of people that are facing the pain out there, that their loved ones are in these long-term care homes and they don't get access to them, and they can't go see them, and they can't help them and feed them, and it's heartbreaking. But this wasn't just the first thing that we've done, and I'll pass it over. This is an enhancement of what we have already done, and we've done quite a bit right from the get-go. But I'll pass it back to the minister, and this is just an enhancement. By no means is this the first thing that we have done. We've done a tremendous amount, but again, my focus is on these poor families that can't see their loved ones, and not all, but majority of people, elderly folks in these homes, they've gone through so much in their lives. They've gone through, wars and so many ups and downs in their lives, and to lose their life over a virus like this, it's heart-wrenching. I can assure you, and I can assure the people out there, I hear it every single day from my home. I hear it every single day from my family, from my wife, and my heart breaks for the families out there. It's absolutely terrible what people and the families are going through right now for their loved ones, and not being able to see their mom, their dad, their grandparents. It's terrible. I'll pass it over to the minister.
So this is an unprecedented tragedy, and we acted swiftly months ago to make sure that there was proper screening, active screening, barring only essential visitors into the homes. And as mentioned, it was a hardship for many families, and we heard about the loneliness and the concern surrounding that. But it was a decision that we did not take lightly. We took it extremely seriously. It needed to be done. And that was the recommendation through the Chief Medical Officer of Health. And we've been following the advice from the Chief Medical Officer of Health, our medical and scientific experts who are informed on the evolving science and evidence behind COVID-19. So we've been actively taking measures this whole way through, putting dollars behind it so our homes could have better infection protocols and measures, as well as making sure that their staffing was shored up. So this is something that we've been actively on, and also recommending the work of personal support workers in only one setting. And now we are moving and taking additional measures. So we are fighting with every single tool that we have, and we're creating new tools because the old tools are not enough. This is a new virus, a virus that the world has not been seen before. And so we have to take new measures, and that's exactly what we're doing today. More testing, more management of outbreak, more additions to help shore up the staffing. And we'll take additional measures if needed. And we're taking the advice and following the advice of our Chief Medical Officer of Health and the science and evidence behind COVID-19.
Next question.
Next question comes from Haley Cooper from News Talk 1010. Please go ahead.
Hi, Premier. Hi, Ministers. We've been hearing from people that say if they remove their loved one from a long-term care home just to get them out of that environment for the time being, they're going to have to keep paying and they will also lose their spot. So are amendments going to be made to this rule that so people won't need to keep paying while they're caring for a loved one, or at the very least not have to worry about losing their spot, or both?
Thank you. We took this into consideration very early because there were concerns about how people would be managed if they left the long-term care homes and went into the community. First and foremost, we want to make sure that people are safe and that they have the resources to go to in the community. Their beds will not be lost. They will be put back on a priority list for readmission to the home when this settles down. However, during an outbreak in a home, there can be no admissions back into a home. And that is unfortunately the case in some of our homes.
Okay, and my second question is for the Premier. It has nothing to do with long-term care homes. We're hearing that the Ontario Energy Board is getting set to put time of use pricing back in place by May 7th. And you yourself have said multiple times throughout this pandemic, and even before that you're not a fan of time of use pricing. So how is it that it's being brought back while people will still be in self-isolation and working from home?
Well, that's one of the items, and you're 100% right. I don't like that time of use anytime, not to mention when people are at home. We'll be sitting down with the President of the Treasury, sitting down with the Finance Minister and Minister of Energy to come up with a solution. So just stay tuned. You'll hear about that over the next little while. But to be very blunt, I'm not in favor of that. Even though we're compensating Ontarians over, I think it's $5.6 billion on energy, and I'm not going to get into politics and the weeds why we're in this position in the first place. But we're going to make sure we protect the people of Ontario, and we'll do whatever it takes, and we'll make sure we don't spare a penny to make sure life's a little more comfortable through these terrible times. So just over the next few days, you'll hear further from us on that.
Next question.
Next question comes from Colin DeMello from CTV News. Please go ahead.
Hi, thank you for taking our questions. I have a couple of questions just about testing. So doctors are calling for the testing threshold in long-term care homes to be lowered because they say elderly patients who get COVID-19 don't have the traditional symptoms like other people. And instead, they may have cognitive impairment, increased falls, low blood pressure, etc. So why is your government not making the decision to test every single asymptomatic patient in a long-term care facility? Why wait until they've already been exposed to somebody who has COVID-19?
Well, again, Colin, I'll pass this over the doctor, but we're increasing the testing right across the board and really focusing on the hotspots of long-term care. And they said that they were going to have 8,000 tests as of today. We get results tomorrow, what happened today. So let's take a look at the 8,000 tests to make sure that we hit that target. And I know that they're going to be really focusing on the high priority hotspots out of the 626 long-term care homes and over 78,000 folks there. We're going to make sure that we look after and target the 100, and I believe it jumped up to 114 homes now, infected roughly about 18% of all homes. So that's the area we're going to target, but I'll pass it over to Dr. Fulton.
Thank you. So this is really surrounding the concept of asymptomatic spread, which is incredibly important for COVID-19. And so as the evidence comes out, and our Chief Medical Officer of Health and Public Health are collecting that evidence and scientific information, we're acting on that. And that's what this action plan is about. We're expanding the testing into homes, even across Ontario, into select homes to really understand how COVID-19 spreads in the long-term care home setting. And as I mentioned before, this is a global phenomenon in long-term care homes. It's happened in other countries along the same lines as what's happening here. It is heartbreaking when you realize it gets through our defenses, and that's what's happened. It's the asymptomatic spread, and we know it's coming from the community. So we're taking all the measures possible, the universal masking, the universal personal protection equipment that the Chief Medical Officer of Health has required for all long-term care homes. And now it's about the testing. So whether it's looking at how it spreads or looking at how we're testing asymptomatic contacts of someone in the home that's been COVID positive, either staff or a resident. And so this is absolutely key. It's about what we're doing right now, and that's already been started. So really, a really important imperative.
And Minister, just to follow up with yourself, can you provide us with an estimate in terms of how many residents in long-term care homes have already been given a test for COVID-19? The Premier would like that to be 100%, but we know we're not there yet. So can you give us with a percentage, even if it's an estimate, of how many long-term residents have actually been tested thus far? Is it 25%, 50%, 10%? How many have actually received the test for COVID-19?
Thank you. I'm going to get that number from my staff. I do not want to make a guesstimate, even if it's a ballpark. It would be a significant number based on the outbreaks, and I want to make sure that it's clear that we've even redefined what an outbreak is. So it's one staff or one resident that is tested COVID positive in a home. So we've lowered the threshold for outbreaks as well. But if you look at the number of homes where there's outbreaks, you recognize that in some homes there's multiple staff, multiple residents who are impacted with a positive COVID test. And so it's a fairly significant number. However, we can't stop there, and that's what we're in the process of doing, is expanding this to long-term care homes, the symptomatic and the asymptomatic residents and staff who might have been in contact, as well as looking at and targeting homes that have an outbreak and saying what is particular is happening in that home, and how can we learn from the spread of this virus, how to approach this. We're looking at redeploying hospital workers, home care people, assessment center workers to make sure that the testing gets done. And so it's about redeploying some of the processes we've already put in place, but we need to do more, and that's clear, and that's what we're doing.
Next question.
Next question comes from Cynthia Milliken from City TV. Please go ahead.
Hello, this question is for Premier Ford. Hello, Premier. We've seen the warning signs. SARS was a warning sign. Advocates have been calling for years that massive changes need to be made, including workers only working in one long-term care home. Will you commit to taking a look at the entire long-term care system and overhauling it when all of this is done?
Well, I think we have to. And, when these tragedies, and it's a tragedy that's been happening not just here but around the world, there's spots that you see there's cracks. And you've heard, I've come up here and been very public about some of the cracks and the holes in the system. This will give us an opportunity to fix a lot of things, not just long-term care. I think overall government, the way it runs as a whole, and look at the procurement system that needs to be improved. I think we have to look at continuous improvement. We brought the continuous improvement lean team from Toyota. They talk about efficiencies. They understand efficiencies along with so many other companies out there in the private sector. And it shouldn't be private sector coming in and learning how the government runs. It should be the other way around. Government should be learning how the private sector runs and how efficient it is and the accountability and the targets that you have to hit. So we need to fix the government. That's why I was elected to come down here. But until, and it's unfortunate, until crises happen, not just in Ontario government, across the world and in major companies too, that when we get hit with these crises, you wake up real quick and see where the gapping holes are and the cracks in the system. This is an opportunity for everyone across Canada and any government to fix their system. And there's a lot to be fixed down here, I can promise you that, and we will fix it, and for the betterment of every Ontarian resident.
Thank you. My next question, it's not just long-term care homes that have had many workers working in multiple ones. I'm told home care workers are also in the same position. One family has an elderly mother being cared for, and different workers are coming in every day. And they're asking for the same worker, but they're being told that's not possible. Do you see this as another crack in the system and a major flaw that needs to be addressed right now?
Well, as long as we have the staff and up-and-coming staff, people that are graduating from our colleges and universities, that we can put them in a system that works better. Cynthia, when my mom was ill a couple of months ago, we saw the same thing. They're phenomenal people, by the way. These people that are taking care of people at home. We saw almost a different person every single day. And again, I'm going to leave that up to the medical professionals, and maybe one of my ministers would like to answer that, because they're a lot more familiar with the healthcare system than I am.
Well, there are situations in home care, also people working in retirement homes, working in congregate care settings. But I think with home and community care, that's one of the things that we hear most from Ontarians about, is the fact that when you have someone coming into a person's home to help their parent usually, and you're helping with things like bathing and dressing and so on, that's something where you really want to feel comfortable with the person that's coming in. You don't want a different person coming in every day. That is something that we have been working on, but we will continue to need to work on post-COVID-19, because that is something that is really important for the comfort, but also for the safety of the people who require home care.
Next question.
Next question comes from Travis Danraj at Global News. Please go ahead.
Hi there, Premier. Good afternoon. You came to the podium last week and you were extremely frustrated. You were pretty clear when you said you didn't want to see any more excuses and you wanted to see 13,000 tests a day. And a few hours later, Dr. Williams walked back those expectations. We're not seeing anywhere near 13,000 tests a day right now. So I'm just wondering if that statement was realistic, and how do you reconcile what you were setting as goals and then what Dr. Williams is saying, walking things back?
I have to listen to the Chief Medical Officer of Health. He's a separate entity than the government per se, even though we all work under the same roof. And yes, I do want to see as many people tested. They promised me it was going to happen. They gave us a guideline, 8,000. We're going to see those numbers tomorrow, 8,000. I hope we see those numbers, 8,000 tomorrow. And then later in the month, they said we'd ramp it up to, I believe it was 14,000 by the 25th of April. So I want to see the numbers. Numbers don't lie. I'm a numbers guy. I want to see measurements and see exactly not only just the 8,000, who were the 8,000 that were tested. And as we move forward, we have the we'll hit the 14,000 target, and just continuously test, especially in the long-term care and other seniors' homes too. We're pretty lucky, but we can't ignore the seniors' residents, even though there's over 500 seniors residents, and we're at about 5% right now that have been infected. 5% is 5% too many. So we have to put an iron ring around all the most vulnerable people that are out there. And yeah, the system, going back to Cynthia's question, the system needs to be changed. It will be changed. And with consultation, collaboration with people from long-term care, seniors residents, and make sure that we have higher standards. Keep in mind, 80% of long-term care homes are basically privately owned, but they still rely on the government. So we have to, raise the standards. This is, Travis, this is a wake-up call to the world, not just Ontario, right across our country, around the world, and we have to learn best practices of other regions around the world and adopt them here into Ontario. Again, we're going to make a lot of changes moving forward.
So with that being said, I'm just wondering, I know that you said that the government's doing everything possible to deal with the outbreaks in long-term care facilities. Would you be open to a public inquiry after this crisis is over about the government's response, looking into the government's response on long-term care homes? And if so, why not?
Well, we'll sit down with our cabinet, and we'll be making sure that we leave no stone unturned and find out where the gaps are. I've been very transparent. When there's something that's not working, I tell the people it's not working. This is the government, and I could walk into any government in North America and show you what's broken. Our job is to find what's broken and fix it in a timely fashion too, not typical government hours. There's private sector hours, and then there's government hours, and they don't match up. And I've said this before. There's ways of doing things that the government's used to over years and decades in government after government. And then there's the way that the private sector does it. We need to get on board with the way the private sector does it and implement the policies. And that's exactly what we're going to do. And there has to be transparency. After this is all over, be it inquiry or other areas, we have to be transparent on where the cracks are and tell the people what we're doing to fix it. Because that's why we're down here, because there was a lot of cracks in this big ship down here. I'll tell you that, and we're going to make sure that we fill those cracks in the holes and start running things a lot more efficiently, because it's been an eye opener. I'll tell you that.
Last question.
Last question comes from Rob Ferguson from the Toronto Star. Please go ahead.
Hi there, everyone. This is for Minister Fullerton, please. I'm sure there are thousands of families wondering right now about the detail of this plan to send hospital-based SWAT teams into nursing homes that are hard hit from the outbreak. So, from outbreaks, how many homes are going to see SWAT teams? I'm assuming Bob Cajun. I'm assuming the one in Hagersville. I'm assuming a few of the hard hit ones in Toronto. So, how many are going to get SWAT teams? When are they going to arrive? How many people are going to be involved? And what exactly are they going to do?
That's being rolled out as we speak over the next 24 to 48 hours. It's already happening regionally in some areas. We're going to make sure that happens across the board. We want to make sure that we have the infection prevention and control teams in, as well as the hospital resources. And this speaks to a larger integrative effort that we have to see across the healthcare system. How our acute care system, our hospitals can work with our long-term care homes and our congregate settings. And I think this is a very important measure that is something we can look forward to in the future. We have to have an integrated, coordinated system, and this pandemic has really demonstrated the significance of that.
All right. As a follow-up, how many homes do you think? Are there 10 homes? Are there 15 homes that are getting this assistance? And what can residents and what can staff in those homes actually expect to see change in the next few days? Will there be doctors and nurses from hospitals in there helping to bolster the staff? What will they see?
Yes, that's exactly what will happen. There will be infection prevention and control experts. Also, public health units will be assessing on a risk level in terms of the homes. It's already happened in some areas where the local hospitals have rallied and supported our long-term care homes in their time of need, and we expect this to be rolled out over the next 24 to 48 hours across Ontario's long-term care homes, as well as the staffing issue. We know that there have been critical staffing issues in some areas, and that's for a number of different reasons. We have staffing shortages even going in to this pandemic, and that was a long-standing issue, and it was something that our government, my ministry, were working very hard to address. And now the pandemic is here, and so there's a more urgent need. So there's a matching portal, there's a federal portal, and the hospital and home care sector will be involved in helping shore up the staff in long-term care homes across the province as needed.
Thank you.
Thank you, everyone.